Hi, I am Dr. Mike. I'm here today with Terry Livingston MD. Terry, tell us a little bit about yourself.
Well, I'm an emergency room physician here in Daytona Beach area. Been working here for 20 years. My training is that I was educated in Canada, took medicine there. Did a residency there, residency here, and a fellowship here in sports medicine. And I work full-time in emergency medicine.
Excellent. Now, what made you decide, Terry, as an MD, to not go the conventional way for your musculoskeletal issues? In other words, why didn't you do drugs or surgeries and you choose stem cell therapy instead?
Well, the injury that I actually had bilateral ulnar collateral ligament tears that I developed 25 years ago when I was a competitive swimmer. The stroke that I did at a collegiate competitive level puts a lot of stress on the medial portion of the elbow. And so both of my collateral ligaments tore. It's the Tommy John injury. The Tommy John surgery is the procedure that you get to repair it. I had it bilaterally, and it restricted and made it impossible for me to basically do the breaststroke, the stroke that I was competitive at in college. So I decided to proceed with stem cell treatment, mostly because the Tommy John surgery for someone my age or even for someone young has a very mixed track record. And after doing lots of research on stem cell treatments and which sort of treatment would be the one that I would choose, I realized that I didn't want the platelet-rich plasma therapy. That seemed, from what the data that was available, it seemed not as effective. And of the stem cell therapies, the mesenchymal cells were clearly superior from my research. And so I looked around for a provider of mesenchymal cells and ended up with NeoMatrix.
Great. Now, we treated your elbow then with the stem cells from the umbilical cord matrix, in more particular from the Wharton's jelly. Now, when was that treatment, and how did you respond to the treatment pain-wise and function-wise?
Well, prior to the treatment, I had a demonstrable defect. There was an almost 1 centimeter gap. It was an 8 millimeter gap between the ends of the severed collateral ligament that had been there, as I said, for 25 years. So realistically, I wasn't optimistic that I would get functional resolution. I was just mostly hoping for pain control, that I would have decreased pain in my daily activities, and particularly when I work out or stress the elbow. However, much to everybody's surprise, including the ultrasound technologist who was doing the studies, after a little more than 3 months, there was actually complete resolution of the tear. There was regeneration of the tissue. It was bridged. My functional capacity was back to basically what it had been when I was 25 years old, and I have no pain.
All right, so those are great results, no pain and maximum functional capacity that you weren't be able to enjoy for many, many years. So those are great results. Now, Terry, I heard you referred some of your patients, but also some family members. First of all, thank you for that, but any input on that?
Yeah, well, I actually got my other elbow done because have had the same kind of result. My son had torn his anterior talofibular ligament on his left elbow or his left ankle several years earlier, and it wasn't healing, and so he had a functional deficit, and so we got him treated, and it was remarkable. It's actually you could see physically the resolved tendon because he's thin, and under stress the tendon sheath was visible, and you could see that it was not there and now it's there. I mean, with your eyes, not only with the ultrasound. So he's had a great result. My wife, who has scoliosis of the spine and also rheumatoid arthritis, has chronic low back issues. We got her injected and she's done terrifically well. It's been like a restoration of her life. She's had great reduction in pain and is able, her functional capacity, she's gone from having to change positions very frequently in terms of not even being able to sit for very long, She's gone to now being back to being able to do some of the things that she did as an athlete in college and be more active and fit and able to sit for long periods of time. And it's really almost been a miracle for her, giving her life back. So my father got some treatments. I mean, I'm a believer. I've had most of my family are patients.
Excellent, and we're happy we were able to help them all. Now, what would you say then, lastly, to physicians who currently dismiss stem cell therapy as a valid treatment option?
Well, I think there aren't very many of those. Honestly, I think stem cell therapy is entering the mainstream. The problem is people don't really, as medical professionals, we get approached by patients to give them advice, and in many cases we don't have the knowledge to be able to really make an informed, give informed advice. And so if we don't know the differences between the different products that are called stem cell, if we aren't able to delineate between, like I say, platelet-rich plasma, which is essentially, not really a stem cell treatment, but people call it that, and so most of what physicians are referring people for is platelet-rich plasma. I think what's important for physicians to do, especially in this day and age, I think for all of us, anyone who sees patients on a primary basis, or even not, because we'll all be approached by people who ask us about these new therapies. I think it's incumbent on us to be educated and informed, and the mesenchymal products, and particularly the umbilical cord products, are clearly the superior product that's available. And as the technology advances, things will change, and I think it's important for physicians to at least be aware of what the treatments are, what their pros and cons are, and be aware that there is something out there that really can help.
And keep up to date. On a note there, we actually have now at Neomatrix Medical a physician education program available to really help the physicians also protect their patients when they inquire about stem cell therapy, because obviously we need to make sure we set them to the right clinic that is compliant with all FDA regulations. Their product need to be registered, etc. So thank you very much, Terry, for the testimonial, and hopefully we can continue to help your friends, patients, and family.
Thank you.